Hi everyone, Dr. Steph here, and I'm back with another video in our diabetes reversal series. Today I'm going to actually combine a few of the things that we see. They are sometimes addressed separately, but very often they're closely connected as far as cause of elevated sugars. So we're going to tie in inflammation, which is essentially your immune system ramping up to attack, defend, destroy, which can be triggered by lots of different things that we've already talked about: infections, stress, things like that. So I will be kind of bringing stress into this mix and how these things actually affect your adrenal glands. Your adrenal glands are two little glands that sit one on top of each of your kidneys, and they are responsible not just for making the hormone adrenaline, but also cortisol, as well as helping with manufacturing a lot of your sex hormones. And remember, we did a whole video on how reproductive hormones like estrogen and testosterone and progesterone can also impact your glucose metabolism. But cortisol in particular is important because cortisol is a hormone that the body makes that very simplistically is the counter hormone to melatonin. Melatonin is your sleep hormone, cortisol is your awake hormone, so it should be secreted in a rhythmic fashion just like melatonin is, but opposite melatonin. So with cortisol being your awake hormone, it should be high in the morning so that you can get up out of bed without an alarm clock and have lots of energy and go on about your day. But cortisol should be almost nothing by between 10 and midnight so that you can sleep, and melatonin will be kicking in and helping you stay asleep. But cortisol is also an anti-inflammatory. So when you think of cortisol, think of cortisone, prednisone. So it is your own body-made anti-inflammatory. So it will be stimulated to be secreted potentially in high amounts off the circadian rhythm if you have anything that is causing inflammation. And remember, inflammation is your immune system being triggered to respond to some type of physical, mental, chemical, emotional stress. So stress will cause you to secrete cortisol off the rhythm, and you will secrete excess amounts of cortisol throughout the day. How does this have anything to do with blood sugar? Well, it has everything to do with blood sugar, because just like some people have noticed when they take prednisone or cortisone, or they've had a cortisone injection, their sugars go way up. One of the problems with cortisol, one of the things that it does when it's being secreted on rhythm in a healthy way, is it actually, as it's going from almost nothing at between 10 and midnight, while you're sleeping, it is slowly going to be coming back up so that it peaks in the morning between 6 and 8. That slow increase over the night of cortisol causes the release of sugar, glucose, quick access glucose that's stored in your liver. It causes the release of that into the bloodstream throughout the night, so that while you're having your sleep fast for 8 hours, cortisol is slowly coming up, and it's causing a slow release, a steady, stable release, controlled release of glucose from the liver into the bloodstream. So your blood glucose is maintained at normal ranges while you're sleeping and not eating to do that, okay? So cortisol causes the release of sugar from the liver and other stored areas into the bloodstream to maintain blood glucose. So if you are being stimulated by inflammation and excess stress, physical tissue damage, inflammation, pain, infections, food intolerances, allergies, things like that, if you are being triggered to secrete cortisol off rhythm in high amounts throughout the day when it should actually be coming down into low ranges, you're going to stimulate the liver and other stored areas of glucose to be shoved into the bloodstream pretty much all willy-nilly throughout the day. So instead of it just happening at one specific time, cortisol secreting sugar into the bloodstream, if you have high amounts of cortisol throughout the day because of inflammation and stress, you're going to end up hypersecreting cortisol. You're going to end up pushing out a lot of sugar into the bloodstream. And a lot of sugar into the bloodstream will eventually end up leading to type 2 diabetes. Okay? So sometimes what we're dealing with when we're seeing patients and they've got a lot of different inflammatory things that are going on, food allergies, infections, gut issues, mental emotional stress, physical stress, pain, things like that. All of those have to be handled so that we can get their cortisol rhythm back in normal range, which allows the blood glucose to calm down into a normal range. So I know that was kind of a bit of a technical video. I hope that kind of gives you an idea that sometimes dealing with type 2 diabetes, if you're looking to reverse it, is not just a matter of cutting sugar out of the diet. It's not always that simple, especially if you've been a diabetic for a while and you've been on medication for a while. You might have a lot of these other underlying things that need to be looked at and addressed in order for you to be successful at reversing your diabetes. So I hope you found that helpful, and stay tuned for one of our upcoming videos in our diabetes series on all of the things that we find clinically that need to be addressed and handled in order to reverse it.